You ever wondered why there seems to be more and more people that are having autoimmune disorders? Hello everyone, Dr. Jason West of the West Clinic, and we're talking about autoimmune disorders. And in the conventional medical sense, there's no consensus of why someone becomes ill with an autoimmune disorder or why did your body decide to attack itself. Well, I think that the reason why is because it's a runaway inflammation or it's your immune system that's throwing a temper tantrum. And the treatment in the medical world for autoimmune disorders is not always effective because in the conventional approach, it's about literally just hammering inflammation. And you start off on one drug that can last a couple years and then goes to the next drug and the next drug. And then what happens is the drugs become less and less. And in my experience over time, sometimes they just stop working. And so a better way is to help the disorders of the immune system and literally help to improve inflammation and improve the healing response. And when I say improve inflammation, inflammation has to be controlled. Too little and you can't heal too much and you're in a state of inflammation. And so many times we're not trying to find the trigger in the conventional medical sense. Is it heavy metal? Is it mold? Is it genes? Is it diet? Is it your environment? And then what happens is all of a sudden the body will be like, I don't like my muscles, and we'll have polymyalgia rheumatica, or I don't like my joints and we can have rheumatoid arthritis, or I don't like my nerves and multiple sclerosis, or I don't like my skin. There's so many different triggers for that. And I have the experience that a lot of times it can be infection related. It can be a runaway bacteria or a viral trigger. And what happens is now the body has antibodies against the organ structure that literally the body's like, you know, we just can't have this organ structure where we go to attack it. Now, knocking down inflammation can give you an improved or a temporarily improved response, but in my experience, it's not sustainable over time. Now, there's always exceptions to the rule, of course, but one of the things that you've seen in our patient success stories is when we take people and we help them to literally retrain their immune system so that we're not attacking the organ structures like the thyroid in Hashimoto's, or the joints in rheumatoid arthritis, or the nerves in multiple sclerosis. And when we give those proteomorphogen building blocks, so there's a specific advanced nutritional therapy that literally almost acts like a heat-seeking missile. So in a war, if the fighter plane is flying over enemy territory and they shoot a heat-seeking missile, what happens is there's a radar on the plane which notifies the pilot that there is an incoming heat-seeking missile, and he can employ anti-missile techniques of hot phosphorus flares and some other things to try and get the missiles to go out after the decoys. That's what proteomorphogen therapy does. It's a specific extract from cattle or pigs that literally helps to be a decoy for part of the immune system until it recovers. So my grandfather taught this to my dad taught this to me, and I've seen really good outcomes for autoimmune hepatitis, Hashimoto's disease, mixed connective tissue disease. I've seen some really good outcomes with rheumatoid arthritis. And so there's not always an anti-inflammatory or an immunotherapy or a chemotherapeutic agents that literally go in and stop the immune system. And so the inflammation is not always the cause of the illness and is a consequence of this runaway immune system. And if we can put it back in balance, people get really good outcomes. So if you have an autoimmune disorder, please be aware of proteomorphogen therapy. Please be aware of neural therapy or nerve reboot therapy, advanced oxidative medicine, sodium ascorbate therapy, healthy cell therapy. There's so many different things can really help to reprogram the inflammation in just setting it off. And if you'd like more information about that, please put it in the comments. Reach out to me on social media, YouTube, Facebook. We're doing patient success stories all the time. I'm Dr. Jason West, and we'll see you guys on the next video.